Are you a female between the ages of 35 and 50? And are you starting to notice some changes? For example, your mood is changing. You're becoming more irritable, more anxious, more depressed. You're also starting to gain weight, especially in the midsection. You feel super tired, even though you're sleeping really well at nights. Well, if you're having some of these symptoms and many other ones, you may be suffering from something called perimenopause. My name is Dr. Ali Dazadeh. I'm a board-certified internal medicine physician that have had years and hundreds and thousands of patients that I've treated for this exact symptom. Perimenopause is the phase that happens right before menopause, and it can last anywhere between 4 to 10 years. And it usually happens because there's a fluctuation of the three main hormones in female bodies. Estrogen and progesterone are the main ones, and also testosterone, which is an important hormone for females. Now, if you start getting treatment early for this, you could actually have a lot of benefits. Based on research that was done recently, if you start early treatment within 10 years of starting perimenopause, then you can reduce the risk of cardiovascular death. That means dying from a heart attack. 2, you can decrease the risk of osteoporosis. That's when your bones become thin and you have increased risk of fracture. 3, you can reduce the risk of Alzheimer's. 4, you can actually get your body weight down to normal and have an easier time losing weight. And 5, you could feel better, less anxiety, sleeping better, less depression, less irritability. But is everyone a candidate for this treatment? That's not true, and not everyone is a candidate. If you've had history of breast cancer, you're not a candidate for this treatment. If you have severe liver disease, you're not a candidate for this treatment. And if you've had clots in your legs or your lungs, you're not a candidate for this treatment. But outside of that, you are a candidate. And early treatment is the way to go. So I recommend you talking to your primary care physician and getting your labs checked, discussing your symptoms, and to see if you're a candidate for this treatment. Now, this treatment can be done either through pills, lotions or gels, patches, pellets, or injections. And the type of treatment that's done, it just depends on your preference and the doctor's comfort. So please discuss this with your physician. Now, outside of hormone replacement therapy, there are other things that you could do in order to improve your symptoms. For example, better nutrition, more exercise, stress management. Some vitamins that can help you are, for example, magnesium glycinate, vitamin D. So those are things that can, in addition, give you some support. If you have any further questions, my name again is Dr. Ali Dazadeh, and I'm more than glad to answer your questions. Have a wonderful day. Don't forget, you can follow us on Facebook, Instagram, and TikTok. If you have questions, post your questions in the message below, and I'm more than glad to get back to you within 48 hours.